Hi everyone. Today, I'm going to be talking about Rocky Mountain Spotted Fever, also known as RMSF. And despite the name, this disease is not just hanging out in the Rocky Mountains, waiting for its victim. It's actually more common in the southeastern and south central United States. RMSF is a serious tick-borne disease caused by the bacteria Rickettsia. It may start off looking like a flu-like illness, but if it's not treated quickly, it can become very dangerous. So basically, this is one of those situations where a tiny tick can cause some very, very big problems. So pathogens, the pathogen that causes RMSF is called the Rickettsia rickettsii. It's a gram-negative obligate intercellular bacteria. This sounds complicated, but it really just means the bacteria has to um, live inside the human cell in order to survive and multiply. It mainly targets the endothelial cell, which are the cells that line the inside of the blood vessels. So instead of it attacking one single organ, uh, instead of it attacking the one single organ right away, it goes after the blood vessels that help supply the entire body. This is a big deal because once the blood vessels are damaged, a lot of the body's systems can start having problems too. If you look at the diagram, you can see that enters the body through a tick bite. They move into the bloodstream and they invade those endothelial cells. Once inside, they multiply. They damage the vessels in the walls, causing inflammation and uh, and leakage. So basically, this bacteria is like a terrible house guest, or somebody that breaks in, wrecks the walls, and then leaves the whole house, falling apart. So RMFS is a spread through a tick bite. The main ticks involve the American dog ticks, the Rocky Mountain spotted wood ticks, and the brown ticks. If it's not spread to person. So thankfully, if you're not going to catch it just by sitting next to someone in class. This infection usually happens when a tick attaches to the skin and feeds to long enough to pass the bacteria into the body. Ticks are often found in grassy, wooded areas, brushy areas, um, brush areas. So people who hike, camp, garden, or work outdoors have a higher chances of exposure. One tricky thing about RMSF is that people do not remember getting bitten because tick bites are often painless. So the ticks really show up, cause chaos, and disappears, like someone who doesn't pay rent.
Oh, brother, this guy stinks!
To reduce transmission, people use insect repellent, wear long sleeves and pants. They often check their skins after being in the outdoors to remove any ticks, to quickly enough to find one. Okay, so symptoms of RMSF is usually fever, headache, nausea, vomiting, and muscle aches. At first, it can look like a high flu. Then once the symptoms appear like a rash, they usually start on the wrist, ankles, and then spreads upwards towards the trunk. Over time, it could become pediacly, the petchly, which means that the tiny red or purple spots caused by bleeding under the skin. This happens because the bacteria damage blood vessels. When those vessels become inflamed and leaky, fluid and small amounts of blood escape into the tissue. This is why patients can develop swelling, rashes, and even severe cases, poor blood flow to the organs. So it's not just a skin problem. If the disease keeps progressing, it can affect the brain, heart, lungs, and kidneys. This can lead to confusion, seizures, organs failures, and even death if it's not treated. In other words, the rash is like the body's warning signs saying, hey, things are going very, very wrong here. So diagnosis and treatments. Diagnosing RMSF can be difficult, especially early on, because the symptoms are vague and can look like any other illness. Doctors usually consider the patient's histories, potential possible tick exposures, and lab findings. Some lab clues can include low platelets, low sodiums, and elevated liver enzymes. Tests like PCRs and serology can help confirm those diagnoses, but one major issue is these tests may not be positive right away. The first line of treatment is doxycycline, and it is recommended for both adults and children. It works best when it starts early, especially when the first 5 days of symptoms like side effects can include stomach upset and sun sensitivity. But those are little earlier ways to deal with untreated RMSF. So demographics. So the one thing to remember is that the tiny tick bites may seem small, but with RMSF, early treatments can be the difference between recovery and a life-threatening illness. Thank you.